to talk about a problem that I get asked to give guidance on from time to time by families, by people who are seeking to get their loved ones into addiction rehabilitation because they are abusing drugs of addiction or they are outrightly addicted. And this is that the people in addiction, the family members who are abusing drugs or addicted, are resistant to seeking care. They are denying there's a problem and they're unwilling to come. So I get asked, Dr. BMS, what do I do? He has refused. What shall we do? Can you come and talk to him and make him accept? And so I would like to talk about this topic of how to overcome resistance to seeking addiction rehabilitation by people who are in addiction. In a previous video, in fact, 2 previous videos, I have talked about how to tackle sensitive subjects with family members and friends. I will put a link in the description on this video below here so that you can remind yourself by watching that video. It will help to understand what we are talking about today. I've also made another video previously that is entitled Dealing with Addiction in the Family. I'll also provide a link in the description below so that you watch these 2 videos together with the one I'm making today, and it can give you a good idea how to approach this problem of resistance to care seeking by people who are in addiction and need rehabilitation. So before we dive into it, as always, remember to subscribe to our channel, to like our videos, share them with people who you know may be needing this message, like families of people who are in addiction and they have told you their frustration about seeking care because this person in addiction is resistant. So, how do we overcome resistance to seeking addiction rehabilitation for people who are in addiction? I will talk about why people are resistant. If you understand why most of the people in addiction are resistant to seeking care, then you will quickly understand how you can overcome this resistance. So this will be the focus of today's video, so that I differentiate it from the 2 videos I've described where I talked about how to approach sensitive subjects and how to deal with addiction in the family. So, how do you deal with resistance? I'm assuming that you have recognized that there is addiction here. Your loved one, your family member is addicted. And we've talked in previous videos how to recognize this. You have also talked to this person, broached this sensitive subject and talked to them, and that they have refused or they're resistant. And that's why now we're making this video, how to deal with that resistance. And as I said, the key to dealing with the resistance is understanding why resistance comes in the first place. And that's what I'll focus on mainly, and then end up by just talking about what to do in all the causes or reasons we have cited for resistance in the first place. So, why do people in addiction become resistant to seeking care when they need it? And sometimes they admit that they need it, but they are not willing to go. The first and obvious reason we've discussed many times, or you heard in many fora, is that addiction is a disease of denial. When someone is in addiction, they do not see like it is a problem automatically. they tend to give excuses, to wish it away, to deny, to bury their head in the sand, proverbially, as we may say. And so the problem grows bigger because you are denying that there is a problem. There's a way drugs of addiction work on your brain, and they hamper your thinking. The thinking brain, the cortex, the frontal part of the brain, which is the reasoning brain, the rational brain, it kills them, that part of the brain, those brain cells. And so these people then, their capacity to think, to reason at a superior level like a human being is reduced. And with that reduction, then denial comes in because you're not able to diagnose a problem, recognize it, because your brain is not optimally working. So the main reason, the first thing is that you're in addiction, this person is likely to go into denial. And so you need to know you're going to deal with someone who, more often than not, they will be denying that there is a problem in the first place. And so if you wait for them to accept that there is a problem, you're not going to succeed, because that acceptance may not come. Just a small percentage of people in addiction will admit that there is a problem. So quickly recognize that you're going to get denial and move then to find out other reasons why this person is resistant to seeking care. I'll list just a few of the main ones. There are many and they cannot be generalized to everyone, and every new person may bring a new reason, but we have those that have been known to cut across many people, and they're the ones that I will talk about. So the first one, apart from the denial that there is a problem, is ignorance. People in addiction sometimes are ignorant that there is a way out of their problem apart from taking the drug they take, alcohol, the marijuana, and the other drugs of addiction we talk about all the time. And remember, people start abusing these drugs because they're looking for something. Sometimes it's just having a good time, but when it comes to addiction, it's no longer just a good time. It has gone beyond the enjoyment, the fun. And so there's something that is making this person continue to take this drug in a harmful way, even when they know that they shouldn't. And this I'll generalize in today's video as pain. In another video in future, I'll break down this pain into its many components. But today, let's just limit ourselves to pain. The people in addiction are trying to cure some pain in them by using these drugs of addiction. The pain could be physical, it could be psychological, it could be social, it could come in many spheres. We'll break it in another video. But there is some pain. This person is not fitting well in their bodies, in the social milieu, the environment they are in, and they think that this alcohol, the marijuana, the mirror is what will get them out. So they are treating some kind of pain, and they are ignorant to any other remedy to the pain that they are experiencing. This is why I'm talking about the ignorance. And so if you can show them, if you can convince them that there is another way out of the pain they are feeling, they are likely to respond positively and say, so I can do something else. And maybe that can be the starting point to them accepting to come into rehabilitation. The second reason, common reason I will talk about why they are resistant, is fear. Most of people in addiction are fearful of what is going to happen if they don't take that alcohol, that drug of addiction. So I call it the fear of the knowns and the unknowns. Some of the common knowns are things like withdrawal symptoms. They know that if they don't take their daily dose of their tipple, they are going to experience headaches. They are unable to sleep. They'll be shaking with tremors. They'll have fever. They'll vomit. They'll be in pain. They'll be miserable. And so the fear of that known effect of not drinking will make them want to drink every day just to avoid those withdrawal symptoms. The lock, we call it in Kenya. Okay, the terrible hangovers, if I may simplify it. There's also fear of the unknown. They do not know what will happen to them if they go into that rehabilitation, that treatment that you are suggesting to them. They may have had some myths, some stories. When you go there, you are mistreated, you will be beaten, you will be given some uncomfortable treatments, and so it's better you continue where you are, drinking, using drugs of addiction, than to go to that place this family of mine is suggesting, which I don't know what will happen there, but I've heard terrible stories. So the fear of the unknown can be a great impediment. And so if you can make them see or appreciate what is going to happen, and they see like it's not as bad as they think, if you can make them see like the hangovers, the withdrawal symptoms can be taken care of, maybe that can just be the inlet in making them accept to come into rehabilitation or seek treatment for the addiction, which is addiction rehabilitation. A third common reason is shame. People in addiction, abusing drugs, have a sense of shame, and this shame comes from stigma, comes from the social interaction they have with their family and friends, the loss that they have experienced in the social environment. You have gone overboard in your indulgence with drugs. People are pointing fingers. People are criticizing you. People are ridiculing you. You maybe have lost your family, your wife, your husband, your children, your job, your wealth, your reputation. So you've sunk to the rock bottom, and with it comes a lot of shame and stigma. And so some people find themselves in a situation where they have accepted that as their fate, and they don't think anything can ever change. And so even approaching that subject like, hey, you're drinking too much, you're using drugs of addiction, let's do something, you are actually just awakening that sense of shame and failure in them. And so they will try to fight back. The ego always tries to fight back like, yeah, I'm also someone. You cannot kick me even when I'm on the ground. And so the ego is fighting that resistance, that refusal to seek treatment is because there's shame. There's a sense of failure and despair in them, which you must recognize and do something about before you get this person to come along with you and trust you, because they may be thinking that by coming along with you, you're just trying to prove that they have failed. You are going to worsen that shame that they have. Another common reason why people resist seeking treatment, addiction rehabilitation, is because they do not perceive that support. The perception that the support that they need is not there. Maybe their family already disowned them and abandoned them, and they feel they are alone. So if one family member comes and says we go to rehab, then they think the others are not supporting. They see, okay, this one is not going to achieve anything because, I'm on my own. People already left me. So even if I go there, it's just a waste of time. My life is ruined, so I better just continue. If this is my destiny, then I better end it on my own terms here where I am, drinking or partaking in my addictions. So you again need to show that you're coming in to support them and support them fully, and maybe then that's just the thing that opens those closed doors. The last one I will talk about is that some people are resistant to seeking addiction rehabilitation or treatment for addiction because they are in families or social milieux that do not support quitting this addiction, do not support rehabilitation, do not support change of behavior. And these are usually families or social milieux where you have what we call codependency and enabling. This is a big subject for us in rehabilitation, generally in psychology, that when someone has a behavior which is unwanted, it's not a good behavior, it's not a healthy behavior, and they need to change, then this person cannot change if there are sections of their social milieu, like family, which make the changing of this behavior difficult, and on the converse, make the continuation of this behavior easy. So, for example, someone is involved in some trickery, some little fraud, a child is stealing things in the home and misrepresenting what is happening and lying about this little thing because they are covering up for little mistakes. They have not attended school, they have not done homework, they have not done some chores in the home. But then there is a family member who covers up for them, who backs them up, who gives them an alibi that is a false alibi. So that situation where the social milieu, in most cases the family, is not united in saying that, yes, you need to change. Some people are giving excuses and saying, no, you're being too hard. Oh, maybe just leave him. It is his life. And some of them are also giving little secrets. You know, they're planning to take you into rehab. So when the family meeting comes, this person already has been tipped what is going to be talked about, and they come carrying their guns and their machetes and their daggers ready for war. So the meeting fails. And so a disunited family, we say, is a family that is not going to get someone to recover from behaviors that are unwanted. And that could be a reason. I'll stop at those that I've cited, but I've said there are others. The ones that I've cited are general to many people, but we have some specific. All you need to do is, you as a family member with someone who is in addiction, you need to take time to study this person and find out what could be making this person resistant. And you can add on to this list. You can vary this list I've listed and then move to the next step, which will be the final part of my video today. So then, when you find out why they are resistant to seeking care, what do? Simply, you tackle each and every of the problems or the barriers to seeking treatment that I have mentioned. So if I go just quickly over some of them, if it is ignorance, before ignorance, if it's denial, you deal with denial by making this person, putting it to them, as many of you as possible, in many ways, verbally and by other demonstrations that actually here is a problem. So you will talk to them, you will show them those failed responsibilities, you will show them the instances when they have been drinking and lost control and caused trouble, had an accident, lost a job. So that information passing and that firmness in passing, that unity of family, of social milieu, makes this person then have no roots to scapegoat, to evade responsibility, and it helps them to overcome the denial. At the same time, as you identify the other reasons, you deal with them like I said. So for example, ignorance. If this person is having pain, which I said is a main sustainer of addiction, maybe they have a disease which gets relieved when they take this alcohol, when they shoot this heroin. They have some arthritis, some pain in the hips after surgery. They have some psychological pain, which they feel a good relief when they take their joint, they take the alcohol. Then if you can show them, tell them, discuss with them that there's a way out of this pain. This other medicine which you can take and it can take away that pain. You will just have cracked that puzzle that is hard. So fight ignorance by giving alternatives to whatever they're trying to treat using drugs of addiction. The second one I talked about was fear. Fear of the known and the unknown. Find out, discuss with them what they are worried about, what they fear. If you fear withdrawal symptoms, then let them know that in the rehabilitation center, we deal with the withdrawal symptoms. Bring them for a visit to see Dr. BMS before they are admitted into rehabilitation, just in my office, or invite us to come, what we call an intervention. We can visit this person, this family, and discuss and answer these questions. So we can let them know we'll take care of the withdrawal symptoms. We can let them know we do not mistreat people who come into rehabilitation. We don't beat you. We do not deprive you, your humanity, your dignity, your freedom. You are in treatment, you are a patient, we are compassionate, we are caring, we are listening, we are understanding. And so you'll be living like you're just in a family, but it's in a family of people who are recovering. You are not in prison or in a torture chamber. Then you dispel those fears they have and you make them amenable to accepting to check into rehabilitation. I talked about shame. These people may be having some deep-seated guilt and shame. Talk to them without provoking that sense of guilt and shame. Don't go to talk to them by condemning them, by judging them, by telling them they are failures, they are bad people, they are a disgrace, you have disgraced our family, you have made our name to be dragged in the mud because of your drinking, you must just check into rehab and get better. No, you're suggesting a cure, which is rehabilitation, but you are using the wrong way. You are shaming this person. You are blaming them. You are making their guilt worse. And you are likely to just make the little of their egos left to rise up, and they resist. And they say, it's better I die with some little dignity in me than to go your way and feel like I've lost my sense of dignity and I've been shamed and ridiculed. So changing that approach or how you talk to them may achieve the result because you did not exacerbate the sense of shame and guilt. I talked about lack of support, the fear of lack of support. When you want to check someone into rehabilitation, you do well if you come to talk to this person as a family, all of you, and not be disjointed. And maybe I can match this with the area I talked about, codependency and enabling. Speak with one voice. Do not have divisions in the family. Others want this person to go into rehab. Others don't want. Others think this person is just being mistreated. This person is not being given a chance to make their own decision. They are adults. They can do what they want. My dress, my choice. Those kind of approaches. Avoid those. Sit together as a family, discuss in the absence of the person you want to help, agree, and then go and talk to this person as one united family. Assure this person of support. Avoid divisions which create codependency and enabling behavior within the family, and talk to this person, bring them into the rehabilitation. Finally, use the professionals. We are there. We have studied this for many years in schools, and that's why we are doctors, we are counselors, we are psychologists, we are psychiatrists, we are nurses, we are social workers. All those cadres of staff, you'll find them in a rehab like where Dr. BMS works, Fountain of Hope. And so come and use us. Let us use our experience, our training, our knowledge to help this person and to help that family navigate these difficult areas so that we bring this person into rehab and they start the journey of recovery. Did this message help you in any way as a family contemplating thinking about bringing someone rehab and not knowing how to approach it? Give me your feedback in the column below. Ask your questions. And if you did, I hope I win your subscription. Subscribe to our channel so that our community can grow. Share my video with a family that can benefit from this message, and let us build a healthy community of BMS, body, mind, and soul that are healthy. Thank you.